Hi, I want to take just a quick minute to talk about uric acid and why you should care about it. So, the reason that I do most of the videos I do is because I will run across something many times in a short period of time in my practice. So, in this case, it's just like all of these people are coming to see me, and I'm running labs and looking at something called uric acid, and it's elevated. And one of the things that I do is I review someone's health history before I look at their labs, and I talk to them and I try to find out what's going on, what's wrong. And most of these people are telling me my joints hurt. They've been diagnosed maybe with fibromyalgia, all these things that kind of undescript joint pain. And that's what they're telling me. And so I run their labs and I look at something called uric acid. And it's the marker for gout. If you've ever heard of gout, it's not something anybody ever wants to have. If you know somebody that's had it, ask them if they ever want it again. They don't. And the classic presentation is pain in the big toe. So you go to the doctor, you say, I'm having pain in my big toe. They run a lab, they see your gout is elevated, and they give you some medicine to bring down your uric acid levels. Well, I look at it very routinely in functional medicine. It's a functional marker. That's what we're asking in functional medicine. We're not just trying to diagnose something so we can give you a drug for it. We're trying to figure out what's going on in the body. So because I see so many people that are hurting, it's something that I run routinely. And overwhelmingly, one theme that I'm seeing is these people are also on some kind of aspirin, low dose aspirin, regular dose aspirin, some kind of aspirin because they've been told it helps thin their blood, or it helps reduce their risk of stroke, blood clots, heart disease, whatever the reason, they're on aspirin. And aspirin is notorious for raising uric acid levels. So let me give you a few things you can do if you're feeling like you have a lot of joint pain. Obviously, the best thing to do is have this uric acid level tested and see what your level is. But if that's you and you just want to try a couple really quick things, the first thing is cut back on red meat and red wine. Those are two things that are really high in purines, and it's these purines that drive uric acid levels up. The other thing is to cut back on fruit. The type of sugar found in fruit, it's called fructose. That type of sugar specifically will raise uric acid levels as well. The other thing you can try is drinking just an ounce or two every day of something called tart cherry juice. It's not regular cherry juice. It's not very sweet. It's tart. But that helps drive down those purines and lowers that uric acid level as well, and will probably make you feel really good. Then, if you really want to get to, okay, let's unpack this a little more, then the things that you start asking are, okay, so obviously no one wants increased risk of developing strokes or blood clots or heart disease or things like that. So why don't we look at the whole picture and figure out what we can do? And maybe there's some other alternatives to using an aspirin. Could we do something else? And we look at, there's several other lab markers that I look at to help people identify where their risks are related to cardiovascular events and inflammatory conditions and things like that. So then we just develop a good strategy for that. But I thought I'd bring you that because chances are you've never heard of uric acid and you're like, why do I care about it? Well, if you're running around and your joints are hurting, you might want to care about it. Because the reason that it feels so bad is because uric acid forms crystals like little broken pieces of glass, and they deposit in your joints. And what's interesting is on these numerous examples I've had of people that have come to me, no doctor has ever checked their uric acid levels because they didn't come in and specifically say, my big toe hurts. Because that's sort of the classic presentation of gout that we all associate with it. But what's happening is that it's not isolated to your big toe. It can be systemic, and it can cause issues. So if you look at uric acid levels, and to be diagnosed with gout, they have to be at a certain level. But really, we know that when we look at labs, there are healthy levels. And for men, you want to keep that uric acid level under 6, for women 5.5. When you get higher than that, you can start to feel that. And women are just a little more sensitive to that. So that's just something you can pull out your labs if you've had some done recently. You can try giving up those things and adding a little bit of tart cherry juice. And if you want some information, reach out to me, and we can set up a call, and I can talk you through evaluating this kind of stuff if you're like, yeah, I had no idea, and let's talk about that. But people hurting and having joint pain is so common, and this is one I just keep seeing over and over, so I wanted to bring that to you.